I was diagnosed with possible cancer, it was actually a phone call from my primary doctor, and I was at work. And she just basically said, you know, there's something in your lung. I don't want you to jump off a bridge, but we need to check it out. Now, I was at work, and I'm sitting at my desk, and I felt like somebody had kicked me in the stomach. And I thought immediately about my family and so forth. But it's very overwhelming. You know, you really don't know anything about it. You're navigating through uncharted waters, and you don't really know who to go to. Even though I work in New Jersey, most of the folks that work in my office are from Philadelphia. And they were telling me, I actually have one coworker in my department that was here 2 years ago, and she said Aria saved her life. And I thought, all right, now here I have a testimonial. Here I have something to hang my hat on. When I went to visit Dr. Ching, I immediately could feel his confidence in what he did, and that made me comfortable.
I think the most important thing when someone is diagnosed with an illness, and particularly a life-threatening illness, I think the most important thing is to understand that the patient's attitude towards the disease is the most important. I do believe in a holistic approach towards medicine, and I do believe that the most important thing that we try to meld is between holistic attitudes with high-end technology, and that combination is the most important to get through people through difficult times.
When I met with Dr. Ching, he explained exactly what robotics entailed.
Robotic surgery in particular, I think, is suited to the most advanced, complicated surgeries, such as thoracic surgery or chest surgery, in my opinion. And this is not done for cosmetic reasons, although there's a cosmetic benefit. It's mostly done for recovery, less trauma to the patient, quicker recovery, less blood loss.
I understood that I don't want to say the old-fashioned way, but I guess, you know, where they cut you open and they crack your ribs and so forth. Somebody tells you that, that's very scary to hear, you know, that's what's going to happen. On the other hand, you're thinking about someone that's possibly going to save your life, you know, but then to hear that there's a possibility that you could do both, you know, in a less evasive way, was definitely the choice that I wanted.
At Aria Torzo, we have the most comprehensive and most advanced thoracic program in the city that includes robotic thoracic surgery, endoscopic bronchial ultrasound, video mediastinoscopy, laser bronchoscopy, and the full gamut of other diagnostic procedures. Robotic surgery in particular is suited towards complex operations because you have full control of the operation with the robotic articulating instruments where you can actually dissect the vessels of the heart and the lung under precise control, 10 times magnification, and complete control of all the pulmonary vessels and as well as the heart vessels. And I think this is very well suited to this particular type of operation, in particular for recovery purposes. I think very strongly the more important aspect of cancer care, more than robotic surgery, more than advanced technological techniques, is that relation between patients and the physician. I think that will carry you forth as technologies improve throughout the years.
After surgery, I was extremely relieved. You know, so many things go through your mind. Everybody's very clear about the possibilities, the things that could happen, and so forth. And when you actually wake up and you realize that you're awake, it's just such a relief.
In Jenny's case, I was very happy to see her coming back to my office and asking me when can she go and lift weights and when she can go back to work. And this was actually a few days after the operation, which I thought that was a little too early, considering that she had a major lung operation. But seeing that gave me a lot of satisfaction as a surgeon to see a patient recover reasonably quickly, and that she was wanting to go back to work and live her life. And that to me is very rewarding as a surgeon. The
recovery at home, the one thing, you know, you're in pain, and you're working through that. But bottom line, just having that relief and knowing that the cancer has been removed, that it's been taken away, and that it looks like you're very clean at that point is a great feeling. After a few days, you start feeling better, and then you start thinking about, when can I go back to work, or when can I start riding my bike. It felt great to get back to work. I work for a paper company. It's very, very hectic. It's very, very fast-paced. We often refer to it as being sort of like Wall Street. It's nonstop. It's constant. Coming back to work and being able to get back to that demanding position and that I love so much was just wonderful.
In general, at Aria Cancer Center, robotic surgery is only one small aspect of full comprehensive cancer care. I think we offer the most advanced, comprehensive, complex, up-to-date treatments overall. We treat all cancers as a team. So although I do my part in terms of thoracic surgery, we have a medical oncologist, we have radiation oncologists, we have a whole complement of multiple conferences with specialized multidisciplinary team members which decide how do we treat each cancer patient.
Since my recovery, some of the things that I really appreciated being able to get back into is my bike riding. One of the things that I consider my surgery and having that surgery and going through that whole thing is just getting back to life.
Again, cancer is something that we're making sure that we try to keep under control. We try to cure patients, and we have to make sure that we are always developing this relationship so that they have appropriate follow-up and that they trust us that we're following them very closely.
When you get a diagnosis of cancer, knowing that it's a life-threatening illness, you will go anywhere to take care of it. I was willing to go to New York. I was willing to go to Chicago. Having a life-threatening illness, it's very important who you put your life, whose hands you put your life into. And I was very lucky to find Aria and Dr. Chang.